Well, here's a surgical video on DSEK. Was a 65-year-old man having cataract surgery done a year ago, ended up having pseudophakic bullous keratopathy. You can see mild stromal scarring as well. Well, start off the case by removing the hypertrophied epithelium so that we have a clear view. Then use calipers to mark 7.5 to 8 mm, making sure that the eye is properly centered. Once you have clear markings, then you start off by doing a tunnel. Earlier tunnel was superior, so I did a temporal tunnel. Make sure the corneal width is not too much while making the tunnel. Make two stab incisions, one for side port and one for placing anterior chamber maintainer. You start with scoring the Descemet membrane using a reverse Sinski hook. Make sure all the Descemet in the surgical field is removed, and the remainder of the Descemet can be removed using forceps. The tags of the Descemet are to be removed. This is the sclerocorneal rim. We have created a lamella dissection at 300 micron depth. We refine it out, then place it near the entry wound after placing a bit of visco. Use a 26 gauge needle, bend it, separate the corneal lamellae. This is the posterior lamellae. Using a bent 26 gauge needle, you place it inside the anterior chamber, making sure that the graft does not fold too much. Using jets of water, unroll the graft, then secure it with a suture, place an air bubble, properly center by ironing the graft. The double ring sign that you see there indicates a good orientation of the graft. Now reduce the size of the air bubble to 80% so that the air bubble is completely covering the graft. Suture the conjunctiva to secure the wound, and then finally place a BCL to close the case. Here's what the case looks like 5 days later. Clear cornea, happy patient, 636 parts vision. Thank you all.